Crash course on the American healthcare system and its challenges, and differences with Canada's. The American healthcare system is a complex web of healthcare providers, insurance companies, government agencies, and patients that work together to provide medical care to Americans. While the United States has some of the most advanced medical technology in the world, the system faces several challenges that impact the quality and affordability of healthcare. One of the biggest challenges facing the American healthcare system is the high cost of medical care. According to a 2021 report from the Commonwealth Fund, the United States has the highest healthcare spending per capita of any country in the world, and yet many Americans still lack access to quality medical care. The high cost of healthcare has led to issues with affordability and access, with many Americans putting off necessary medical treatment due to cost concerns. Another challenge facing the American healthcare system is the issue of access to care, particularly for those who are uninsured or underinsured. Despite the passage of the Affordable Care Act in 2010, which aimed to increase access to healthcare for all Americans, millions of people still lack health insurance. In 2019, 29.6 million Americans were uninsured. The quality of care provided by the American healthcare system is another area of concern. While the United States has some of the best medical technology in the world, there are still disparities in healthcare outcomes based on factors such as race, ethnicity, and socioeconomic status. For example, African Americans have higher rates of infant mortality, heart disease, and cancer compared to white Americans. Another challenge facing the American healthcare system is the shortage of healthcare providers, particularly in rural areas. According to a 2020 report from the National Rural Health Association, more than 20% of Americans live in rural areas, but only 9% of physicians practice in these areas. This shortage of healthcare providers can lead to issues with access to care and can impact the quality of care provided. Finally, the American healthcare system faces challenges related to the opioid epidemic, mental health, and the aging population. The opioid epidemic has led to an increase in overdose deaths and a strain on the healthcare system. Mental health services are often underfunded and difficult to access, while the aging population requires specialized care and support. Overall, the American healthcare system faces significant challenges that impact the quality, accessibility, and affordability of healthcare in the United States. Addressing these challenges will require a comprehensive approach that involves stakeholders from across the healthcare industry, including healthcare providers, insurance companies, government agencies, and patients. One interesting example of the challenges facing the American healthcare system is the story of Gwendolyn Barton, a woman who was diagnosed with breast cancer but was unable to afford the cost of treatment. Barton, who was uninsured at the time, was quoted a price of $200,000 for her treatment. Despite working multiple jobs to try and pay for the treatment, Barton ultimately passed away from the disease. This tragic story highlights the impact of high healthcare costs on individuals and the need for affordable and accessible medical care for all Americans. Another example is the story of a woman who was charged $39.35 for a Band-Aid during a visit to the emergency room. The woman, who had a small cut on her finger, was shocked to receive a bill for such a high amount. This story highlights the issue of surprise medical billing and the need for greater transparency in healthcare pricing. In addition to these examples, there are many other stories that illustrate the challenges facing the American healthcare system. For example, the COVID-19 pandemic highlighted the disparities in healthcare access and outcomes for marginalized communities, with Black, Hispanic, and Indigenous Americans being disproportionately impacted by the virus. The pandemic also highlighted the importance of healthcare workers, who have been on the front lines of the response effort. Another example is the ongoing debate over healthcare policy and reform in the United States. While the Affordable Care Act was a significant step forward in increasing access to healthcare, there are still ongoing debates about the best way to address issues related to healthcare costs, access, and quality. Some advocates argue for a single-payer system, while others advocate for a more market-based approach. The American healthcare system also faces challenges related to innovation and medical research. While the United States is a global leader in medical research and innovation, There are concerns that the high cost of medical research and development is leading to high drug prices and making it more difficult for patients to access necessary treatments. Here are the top 10 differences between the American and Canadian healthcare systems. 1. Funding. The American healthcare system is predominantly funded by private insurance, while the Canadian healthcare system is funded by a combination of federal and provincial taxes. 2. Coverage. The American healthcare system is not universal, and many people are uninsured or underinsured. In contrast, the Canadian healthcare system provides universal coverage to all residents. 3. Cost. Healthcare costs are much higher in the United States than in Canada, both in terms of overall spending and out-of-pocket costs for individuals. 4. Waiting times. While there are often long waiting times for non-emergency procedures in the Canadian system, the American system also experiences waiting times due to administrative hurdles and insurance company approval processes. 5. Physician compensation. Canadian physicians are generally paid less than American physicians, but they also do not have to deal with the administrative burden of insurance company negotiations and billing. 6. Medical malpractice. Medical malpractice insurance rates are much higher in the United States than in Canada, leading to higher costs for patients and physicians. 7. Prescription drug costs. Prescription drugs are generally cheaper in Canada due to government regulation and negotiation, while in the United States, drug prices are often set by pharmaceutical companies. 8. Technology and innovation. The United States is a global leader in medical technology and innovation, while Canada tends to lag behind in this area. 9. Health outcomes. Canadians generally have better health outcomes than Americans, including lower rates of infant mortality and longer life expectancy. 10. Political polarization. Healthcare has become an increasingly polarizing issue in the United States, with debates around access, cost, and quality becoming increasingly partisan, while in Canada, there is generally more consensus around the importance of universal coverage and access to healthcare for all residents. Overall, the American healthcare system is a complex and multifaceted entity that faces a variety of challenges. While there are no easy solutions to these challenges, addressing issues related to healthcare costs, access, and quality will require a collaborative and comprehensive approach from stakeholders across the healthcare industry and beyond. Here is a poem on the American healthcare system and its challenges. In the land of the free, the sick cry out, their voices lost in a system of doubt, where healthcare costs can break the bank, and those in need are left to thank their lucky stars for a chance at life. Amidst the endless, ongoing strife, insurance companies call the shots, denying coverage with no second thoughts, leaving patients stranded, lost in the fray, with nowhere to turn, and no words to say. For those who can afford to pay, the best care is just a phone call away. But for the rest, it's a different tale. A journey of pain, hardship, and travail. From coast to coast, the story is the same. Of people struggling, fighting in vain, against a system that's broken and flawed, where the rich get care, and the poor are clawed. We need a change, a better way, where healthcare is a right, not just a pay, where compassion and care guide the path, and the sick can heal, free from wrath. Let us come together, hand in hand, to create a system that's just and grand, where health is not a privilege, but a given, a right for all, and a hope for the driven. *****. We hope this video has given you a taste of all the incredible experiences America has to offer. If you're ready to start planning your own adventure to North America, please ensure to use our Booking.com referral link, https://www.booking.com/index.html?aid equals 7989335 to book your flights, hotels, car rentals, local attractions, and more. It's an easy and kind way to support this channel and make sure you get the best possible deals on your trip. Thank you, AnHub Metaverse team.